Welcome to Concussion Fix Minisodes. These bite-sized clips are taken directly from our full podcast episodes to give you direct answers to your specific questions about persistent concussion symptoms and recovery. Short, clear, and packed with value. Now remember that these clips are not medical advice and you should always speak with your healthcare provider before attempting anything you hear on this channel. Let's go.
Okay, great. This one is a question for you, actually. I'm on the exercise module, and you mentioned I got my polar heart rate monitor yesterday, and you mentioned that we should be doing steady state cardio. So I've been walking and then interspersing jogging for about 20 to 30 minutes, but it's making my heart rate fluctuate. So how do I increase my heart rate steadily for the whole time if I'm not ready to jog for the whole time?
One of the best ways to do this is obviously on like a treadmill.
Okay.
When you're outside, there's just more variables, right? Like you might have a couple little hills, you may have to stop for traffic or whatever the case may be. So it's harder to keep things steady. What I typically do with patients that are having this issue is that I actually tell them to use a treadmill and stick with walking, just because sometimes the bouncing can cause some confusion, because if you're bouncing a lot, it could be visual motion, it could be vestibular, you could be jamming your neck up. Like there's a bunch of different variables that start to play. So typically what I'll recommend is either an exercise bike where you can maintain kind of an RPM, find the heart rate, and it's easier to stay at that heart rate. You're not going to get as much fluctuation. Another option is on a treadmill where you basically do a Buffalo treadmill test on yourself where you put it to 3.3 miles per hour, which is a walking pace. And then you just increase the incline until you hit the heart rate that you're supposed to be at. And then you're basically just walking uphill at that, easy walking pace. But because it's uphill, your heart rate is higher. Right. So
it was more ease of use of being able to do this really consistently. I've got, like half an hour in the morning before, work and kids and et cetera. And I don't have a treadmill. I'm not part of a gym. Like it was more, ease of use and just making sure that this happens every day.
Yeah.
Like that's what I had access to and like a limited amount of time.
Yeah. Yeah. What's your heart rate level that you're supposed to?
So yesterday was the first time I measured it. It was around.
So let me ask you this then: Have you established what your threshold is yet, or no?
So I have an appointment. I found a clinic near me, and an appointment next Wednesday for the. I called asking for the Buffalo test, but they basically said they can do that, but they're going to also do a full baseline evaluation.
Yeah,
I didn't know what that meant. Like, what does that mean?
Yeah, because you can't just come in and do a test, right? They're going to have to take a history. They're going to have to, make sure that you're able to do, like, there's a bunch of things that have to be done. So they're going to have to just do an assessment on you just to make sure that there's nothing else that, you have to make sure that you don't have any contraindications to doing treadmill and whatever else. So they'll do like a full kind of assessment on you before they do that. Usually the treadmill test is the second visit. We just do like history, neuro exam, those types of things first. And then the second visit generally is a treadmill test. So you'll get it, which is good. Did you have increased symptoms when you were doing your exercise?
I had a headache before I started, so that.
Did the exercise make it worse?
No.
Yeah, because that's what we're looking for, right? We don't care.
Anything, it probably made it better.
There you go.
But so it's oscillating. So there's like little gray and blue bars, etc., about your level. So my max is 182, my total max. My just standing resting heart rate is around 78 or so, and then it was kind of going up. I wish I could attach this, would be more helpful, but it was like going up around just the very low gray bar. So I'm not like around in between 91 and 110. And then as I started to get later it was in between like 109 and 127, but it's like the line is like wiggling all over the place. Like it's not staying right around the same.
Yeah, that's normal. It's gonna do
Okay.
that, right? Your heart rate's
Okay.
gonna kinda go up and down and up and down and things like that depending on what's going on, but, um,
Because I was like running, walking, running, walking.
well, that's why that's yeah. Yeah,
Yeah.
so you wanna try and find a pace at which you can be somewhat steady. Now, if you're doing it without a treadmill, then what you wanna do is start with 50% of your max heart rate, right? So if your max, based on your age, is 182, then you would basically be starting at, like, 90, right?
Okay.
So you could pick a range of 90, so you could say from 85 to 95, and that's probably gonna be
That's
a walking pace to start,
pretty easy. Yeah.
right? So you're just gonna be walking the whole time. And then if that's fine and you don't get an increase in symptoms, right? I don't care if you have a headache before you start, it's does exercise make the headache worse
No,
substantially?
no, no, no. And
Good,
I do this every day. Like, yeah, I do
good.
the walking and jogging every day. Yeah.
Okay. And then if that's fine, then the next day, then you bump up to 55% of your max heart rate. And if that's fine, the next day you bump up to 60% of your max heart rate. And then if that's fine, the next day you bump up to 65. So
I
all of it,
guess I'm wondering, like, there's only so fast you can power walk, right?
yeah.
And then, like, if you don't have a treadmill and then I can't run the whole thing yet, is it okay to be kind of going walking, running, walking, running?
Yeah, I think that's fine as long as you're not going beyond what the heart rate threshold is, right? So if you're trying to be at 65% of your max heart rate, I would probably give yourself a range of like 55 to 65. And if you get up to that 65, then you have to slow your pace down to keep it below, or you have to, walk for a bit to bring it back down.
Okay.
Yeah, and that's okay. That's okay. Really what it
Okay.
is that top line you don't want to pass. You want to stay there. Um, and then if that's fine, then the next day you bump it up, right? Now you're at 70% of your max heart rate, right? So you're probably gonna have to do a little bit more running, but again, pay attention to that top line and just keep it below that top line. But once you get the treadmill
Um,
test, it'll tell you whether or not you even need to worry about your heart rate at all. Because you might pass the treadmill and then it's fine. You don't have any issues to worry about. And generally, in the people that I see that exercise makes their symptoms better, that usually indicates that there's either like an anxiety component to their symptoms or a neck component because exercise will
I know there's both. I guarantee you there's both.
right. Right. And exercise helps with like, endorphins and mood and all these good positive, effects from like an anxiety mental health perspective, but it also helps your tissues to loosen up, right? It'll reduce tension in your muscles because now they're warm, right?
My
Because you
neck also hurts when I run. Like, it's kind of physically painful for my neck and back
yeah,
to run. Like, it's
yeah,
less about, "Oh, this is hard for my breathing and my heart rate," than it is, "This is just really uncomfortable right now for
right.
me."
Where are you located?
In Los Angeles, it's the San Pedro Physical
Oh, good.
Therapy.
Oh, great. They're awesome.
I heard she's really awesome,
She
so
is. She's great. So
unfortunately, they were like, "Oh, yeah, your insurance is gonna probably totally cover it," and then they checked and called back, and they're like, "Actually, it doesn't cover it at all."
oh, no. Oh, no.
So that's a bummer, but I read all the reviews, and they literally have nothing but five-star reviews, and it's really incredible, I think. So,
Yeah.
it
She's
is what it
awesome.
is.
She's awesome, really well experienced. They've been with us for a while, and they were treating concussions before they even joined our group, so they have a lot of experience.
Okay, great.
I think you're in good hands, and they might even, generally visit number 3 is when we start taking a look at your neck too. So once they start incorporating some treatment there, that might help with your headaches and your symptoms as well. Like, you know what I mean? So it all kind of
So is
fits
soft
together.
tissue something that they would do there?
I'm pretty sure, yeah, most of our clinics would do
Okay,
it.
okay.
Yeah.
And then I just have a quick second opinion question for Dr. Herkel. So is he
Yep,
Yep.
I'm
is he
here.
here? Okay. Um, so I'm in the middle of the Dutch test, and my naturopathic doctor said that it was okay to stay on my progesterone while doing the test, just because there was a concern that I couldn't really even function for like an entire month without taking it and like work
Okay.
and live my life. And obviously on the write ups and everything, it says don't continue to do this. My question for you is, she said that she would be able to read the test knowing to write down when I took the progesterone on which days, and that she could read the test knowing that I had that. Is that something that you ever do, or do you always make people stop their hormone therapy? Like, I'm paying $800 for this test, and I want to make sure that it's accurate, but also I have to be able to function, and
For sure.
I don't think I could function without the progesterone.
Yeah, I think it sounds like it's a balance call between, if you're able to function with it and not. The Dutch hormone test was designed to gauge the efficacy and the levels while taking bioidentical hormones. So that recommendation she's making is absolutely something you can do, and she'll just factor that into the interpretation. So I think you're fine with that.
Oh, okay. Wait, so on the test, it's like, oh, it says it's not designed to be taken with hormones on the write up in the thing.
No, that's not my understanding. I don't know what particular writing. It could be again, because there's a section, like if you look at it in the requisition, I don't know if you've had a chance to fill it out. There's a section, put down your hormones, like whatever you're taking. So, I mean, I don't know where they're writing that. I think ideally it's more so it's the synthetic versions of hormones, like an IUD.
Oh, yeah, it says hormone replacement therapy. So that's
Yeah.
not what I'm doing.
If
How
you're
does that
using
count?
bioidentical hormones from your naturopathic doctor, that actually is going to be picked up because it's identical to what your body has. And that's being tested. Where if you take something like the birth control pill or an IUD, these are synthetic hormones, and that's going to suppress your body's own remaining levels of estrogen and progesterone production. So those two things are not exactly the same, and they won't be picked up the same.
Perfect. Thank you.
You're welcome. I'm glad you're getting the test.
Yeah, me too. Oh, well, actually, one quick question. There's a line that says ICD-10 codes. What does that mean?
Yeah, ICD-10 codes are just mainly for insurance, where you put a specific diagnoses, and that's only in the US. We don't really use that here in Canada. You can just leave that blank, so don't worry about that. That's for your ND to worry about if they even care about that. But otherwise, yeah, you're okay.
Thanks.
Thanks for listening to this Concussion Fix Minisode. If you want to learn more about the causes of persistent concussion symptoms and how to fix them, join one of our upcoming free 90-minute patient webinars. Details and sign-up links are in the description. You'll see that with the right approach, recovery is possible. See you there.